quick lesson on how to insert an oral airway and a nasal airway. One of the reasons why we have to use these nasal and oral airways is because if a patient goes unresponsive, his tongue will actually go back to the back of his mouth and cut off all the circulation and air going to his airway. So these airway adjuncts over here are kind of ways that we are able to solve that issue by, and the first one I'm going to show you over here is the oral airway. And this is basically just going into the mouth and pulling the tongue back. Now you want to use the oral airway if the patient is completely unresponsive. Now the nasal airway kind of differs because that can be used if a patient is responsive, also unresponsive. Some of the counterindications why we would not want to use an oral airway is if the patient has any type of hypertension of the neck, or if there's any type of dentures in the mouth that are loose, or if teeth are missing, or anything like that. Now, okay, so we're going to start off with our oral airway, or I'm sorry, our nasal airway. Now, the first thing you want to do is measure this from the nose to the back of the earlobe, like so. Then you move this up and see, fits right on there for him. Now, if you take a look, these are obviously for infants. Now this would not work out at all. So that's kind of how you measure that. And okay, so after you measure, you want to stick it inside the patient's right nostril, and then you want to make sure and check that the circumference around this is smaller in the right, not in the nostril, so it obviously goes up. Alright, so as I insert this, I want to turn it at a 180 degree rotation, and it just slides right in there like that. Now I don't know if you're going to be able to see this, but you will actually be able to see the airway down in the mouth. Alright, so that is basically a nasal airway. Now, obviously in the field we would continue to ventilate the patient by using a bag valve mask, and that would be hooked up to an oxygen tank. Moving on to our oral airways, we would first take this, and obviously as I said before, we would make sure that the patient is unresponsive. We would measure this by going basically from the jawline, from the tip of the jaw, from the tip of the mouth corner to the earlobe, or along the jaw. What I do is I want to take the tip of the oral airway, and put it towards the roof of his mouth. As I'm sliding this in, I want to turn the oral airway at a 180 degree angle, so it just slides right in there, and it's going to fit right in between his teeth, so the airway doesn't go down into his mouth or swallows it or anything like that. So basically his tongue is crunched up against his mouth, so there's nothing blocking his airway. And again, we would continue to bag valve mask the patient with the oxygen after that.